Hi guys, this is Mike Sisk, Mickala Sisk, coming to you from Flower Mound, Texas. Been on a little bike ride today, and so Mickala and I have been talking about, how we get this social media message out. And so we've had endorsers, some great endorsers. We've used talk radio, we've used a lot of things, and for really 11 years, we've done the hormones right, we've done the exercise right, and so we took 12 weeks, and we've been doing the diet right. So from that, we decided that we'd start this campaign and call it Age is Just a Number. So over the coming 8, 10, 12 months, we're going to have a topic every month, both at HerCare and Low T Center, and we'll have our endorsers, we'll have our providers, and we will really focus and break down the things that make men and women not feel like they want to feel. So this month, we're going to talk about just the annual health assessment, because really everything starts with a health assessment. So, it's just like your automobile for the guys. If your truck, you're driving your truck and the light comes on, the first thing you do is you take that thing to the dealership to find out what's wrong. If a guy doesn't feel like he needs to and wants to, then his warning light's on. But guys are notorious for not going to the doctor. I was that guy. And so all we want to do is get the guys in there. We're going to do a health assessment. And from there, we'll come up with a plan to make the guys feel like they want to feel. I know, Mickala, you guys do some things at HerCare really similar to that. Kind of talk a little bit about that.
Right, so the difference in women and men, we're already looking for someone to help us. So we don't feel good, we don't have energy, our hormones are messed up, so we're looking for help. The problem is it's hard to find someone that will listen to us. Everyone's different and we are not all treated the same. So when you come to HerCare, we run your labs, we do a health assessment on you also, and we determine how you need to be treated, and one person's not like the next person. We listen to your complaints, and then we start working with you to get your hormones optimized, check your vitamin levels, and get you to feeling better.
Now, just like Low T Center, the great thing about our practices is, we're patients too. So nothing hacks me off more than I call in and you get in that stupid dollar thing. You can't talk to a live body. So when you call our centers, you actually talk to a live person. And then we try to get you in there as quick as possible. Now for testosterone on the guy's side, they want your testosterone checked twice a day. Twice back-to-back days. So we're going to have you come back. But really, I'm going to run a whole battery of labs on you, or my providers are. And so it's a very efficient way to do that anyway. If we determine that you're a snorer or you're having sleep problems, we have the opportunity for you to take a home sleep study home that day. So when you come back, I can have our board-certified sleep specialist. She'll have read that for you. So we truly can do a full assessment. I'm assuming you guys can do the same thing in HerCare?
Yes, we check, we do sleep also. Women, when they go through menopause, unfortunately, we have problems sleeping also. So we do check that. We check for different things like anxiety, cholesterol problems, anything that as we age and life comes at us that could cause health problems. We try to evaluate anything that you might be dealing with so that we can see what we can help you with or how we can help you.
It's funny you say that because I just today in my email I got a email from one of your patients' husband, and he talked about how his wife, she was actually going to have to sleep in the other room because it got to where he just couldn't sleep, and he was thanking us of what an awesome experience it was. It's and everything that we do, I'm a patient as well, and I went to a lab and did a sleep study. I've tried. I think I have every CPAP machine ever made known to man. And it really isn't the machine that makes this thing work. It was the mask.
Right.
And the mask was what made this young lady or the lady had used the machine.
Well, one of the things that we do at Low T and at HerCare, the mask is what really determines if you're going to wear the mask, right? So when you come in, we have different masks for you to try on. And we ask you to keep it on for a few minutes and go through a few. That way you can realize that it's really comfortable. If you fit with the right one, it's very comfortable, and we get your pressures right. So when you go home, it doesn't make you anxious or nervous because you've actually done it in the office and you realize how comfortable it really can be. And I've actually had a patient tell me that She has been cleaning out the garage, cleaning things that she's never cleaned before. It wasn't anything that we did other than we put her on a CPAP machine, and she's actually sleeping. And she told me, she said, I would have never taken the machine home, but they tried it on me in the office. I wore it for a few minutes, and when I realized I could wear it, I took it home.
Right. So, a lot of people, they think low T center, like, Mike, all you do is testosterone. And so really for 10 years, that was very true. But all my patients kept asking, Mike, man, I need a physical. I need help with my sleep. I take these cholesterol meds. I take these high blood pressure meds. So we brought on a Dr. John Osborne. He's a board certified cardiologist. I know he works with HerCare as well. So we really expanded our services to true men's wellness. Our job is to make a man feel as good as he wants to feel. And, Mickala and I will share our what we've done really the past 12 weeks. And, it's been a fun journey for us, right? So as I talked about, we've done the diet, the exercise, and we've done the hormones for 12 years. And then 12 weeks ago, we decided we were going to see our abs. And, I went to a bodybuilding buddy of mine, and we kind of turned our training over to him, and he gave us what I thought was a pretty fair diet. And candidly, I didn't think it was going to work. What were your thoughts when Winston gave us that?
I had my doubts, but I'd always, if I wanted to lose weight, I just didn't eat. So that's how I controlled my weight, which is not very healthy. We have lots of doctors that work with us, and every one of them will tell you going without food is not a healthy thing to do. This diet, we were actually eating 5 times a day, so I had my doubts that it would work, but it did. It was amazing to see what could happen if you followed the diet the way you were supposed to. We were both very motivated to stay on the diet. We didn't cheat a lot. We did cheat a couple of times, but for the most part, we stuck with it, and it was amazing to see what happened.
Yeah, and if you and your wife work out and you're not working out together, you're really missing an opportunity, because nothing motivates you more than seeing your wife lift weights, because, you're not going to let her lift more than you. And, if she does one more rep, you're going to do one more rep, and vice versa. I know you're crazy competitive, and, you pushed me pretty hard.
Yes, I'm very competitive. I don't want to lose.
So when I started Low T Center, I had a 38-inch waist. I think I could bench 95 pounds. I came home and complained about being tired all the time. And, we were doing testosterone in my house. And our hope was we could find a place to help me here in Dallas. And we couldn't. And so that's what motivated us to start the Low T Center. And, I remember we opened that center. We had a great provider there. And, 11 years later, all the things we've learned. But we have learned it's a lot more than just testosterone for guys. And, the past year, we've learned, man, if I fix a guy's testosterone and I fix his sleep and I get his blood pressure right and I get his cholesterol right and everything's clicking, man, a 51, 2-year-old man can look like this. And it's all motivating, right? It's exciting. You as my wife, what has it made a difference for us?
Well, when we were going to the gym and you were getting so frustrated because you thought you were working hard but couldn't see any progress, and then complaining because you were tired every day at 2 o'clock, and I was trying to be patient with you being so tired with, we have 3 kids and busy lives, and it was a little not frustrating, but just trying to figure out how to help you and not really know how to help you. And then when Low T Center, we started giving you injections at home, and could see the change, that you just felt better, and you're just, when you go to the gym, you tried a little harder because you felt better and you were a little more active. And then when Low T Center opened and the patients started coming in, I actually saw the same thing with the patients. When they first came in the door, it's kind of a slump and just not really motivated. They know something's wrong, but not really sure what is wrong. And then after they had been there for a while, you could see them come in, their shoulders are up straight and they're happy, and it was just, it's life-changing. And you could tell, not just from you, but you could tell from lots of people that were coming in the door.
So just, we talk about, testosterone, and when we got into sleep, my kids made fun of how much I snored and how loud I was. So I've been on this CPAP machine for a year and a half now. How has that affected us? I mean, nobody could believe you could sleep through my snoring. How on earth, did you do it? And, do I still snore, or how does it work with the machine? Obviously, I'm asleep, so I don't know what's happening.
So now you're very quiet, which is different. I was a strange wife that could actually sleep through snoring.
It's crazy, right? I would wake me up snoring.
Nobody, I don't understand that, but no one else could.
Because we're meant to be together, right?
Right. The kids could hear you upstairs in their rooms and would shut the door because you were snoring so loud. But now you don't snore at all. You're very quiet. So
we had some scary nights there.
Yes.
We wake up gasping for air. Remember one night I had to walk around the hotel because I was so amped up and
Right.
thought I was dying. I mean, it's you think about had we really just not fixed that. I mean, I probably was shaving years off my life. I know when my provider saw that home sleep study, even the one that we went to the lab, they're almost identical, and they were like, "This is the worst sleep study we've ever seen. Whose is this?" And they pointed to me, and it was like, "What the hell?"
Right, and I thought snoring when you woke up in the morning, that meant you survived snoring. What I didn't realize was the pressure that it puts on your heart.
Right.
And knowing why they were so concerned, it wasn't that, it wasn't like what I thought. If you wake up every day, you won, but over time, your heart gets really tired.
Right.
And yours was so bad, the likelihood of your heart giving out was very scary for them.
Yeah, so if you think, wait, 38 inch waist, weighed 260, terrible sleep apnea, didn't really have the best diet, still I milkshakes back then. I mean, I probably wasn't going to see my grandbabies. I mean,
Right.
Not to be dramatic, but you look at us today, who knows how long we've got, but we've done everything we possibly can. I mean, it's as clean as we could possibly live right now, right?
Right.
And it really isn't that hard. We've had fun, right?
It's been fun.
Yeah.
I enjoyed it. It's
So-
been fun watching the change.
Now talk about HerCare. So, obviously, guys are like, yes, man, my wife, she's complicated. And, so I know, women, they're like, I'm not going to do, that CPAP machine, but they know they're going to get hormones at some point. That was the difference between guys and girls. Like I never, my dad never sat me down one day and said, hey, son, now one day, you're going to get to feeling bad and you're going to need to go see a hormone specialist. I remember when I came home and told you about testosterone, you were like, what the hell is that? And, we found Dr. Morgenteller's book and started studying, and, man, we learned a lot about it.
Right.
But women seem to be looking for that day that they're going to have to go. And so, HerCare seemed to do a good job getting you through menopause. Talk a little bit about that.
Right. Menopause has not been bad for me.
Which is unusual,
not what
right?
I had dreaded for so many years. When HerCare started, Low T was about 3 years old, and we started having women ask what we could do for them. So the idea was just to open one HerCare because we were so busy at Low T. And then I realized that it's really hard for women to find someone to help them. And I started asking women, where do you go? What have you done? And so I learned from them. And one of the doctors at Low T decided to go over and help start HerCare. And we opened the first one, and I started getting all the hugs, which was nice. I'm not the physician, but women feeling so much better and thanking us for listening to them and helping them, because they had problems with people just listening to start with. And as I said before, we treat every woman is different, so they're not all treated the same. What's good for one person is not good for the next. So we've grown from that, and we have 6 locations now, and helping a lot of women.
All in Texas,
and
right?
I still get the hugs. We're all in Texas.
Perfect.
Yes.
So, it's there's a lot of information in that to unwrap, but really, I think if you could boil it up, all guys, all girls need to go get a health SMS. Go to Low T Center, go to HerCare, go to your doctor, go somewhere, get checked out. Don't feel bad, man. If you're overweight and you got sleep apnea, you're shaving years off your life. So you need to go somewhere and get that checked out. And, I would argue we're probably the best in the business at it. I know you would argue the same thing on the women's side.
Absolutely.
And it's just, we're patient zero for everything. So if you see something that I can do better, my email, I publish it out there. It's mike@lowkeycenter.com. Mickala's is Mickala@HerCare.com. That's HerCare with a K, right? That's the
HerCare with a K.
So, but look us up on Twitter. Follow us on Facebook, Instagram, all of the social stuff out there. But, stay tuned. There's a lot of good information coming. We'll be running specials as we launch this stuff. You can kind of follow Mickala and I on our crazy endeavors. And thank you for giving us time today.